Hello, I'm Dr. Suvro Banerjee. I'm a consultant interventional cardiologist at Apollo Clinicals Hospital. I'm going to talk today on sudden cardiac arrest. Now, I think what we need to know first is what is a cardiac arrest. A cardiac arrest is a condition where the heart suddenly stops beating and there is no effective pumping of the heart. It fails to pump blood to the other parts of the body. Now, this happens either because the heart beat becomes very low, that is, the heart rate becomes very low, or because the heart beats at such a fast rate that there is no effective pumping of the heart at all. Whatever may be the reason, the patient may black out very soon because of loss of blood supply to the brain, and if it is not timely intervened or if the condition is not reversed, then the patient may die. Now, this is cardiac arrest, and this usually happens when a patient is very sick, in the hospital bed or in the terminal stage, where and has other comorbidities. This is the most common cause, the way how people die. But sometimes this may be a bit unexpected, and that is what is sudden cardiac arrest. Sudden cardiac arrest refers to the same thing, but it happens when someone is not expecting it. In other words, the mode of the cardiac arrest and the timing of the cardiac arrest is very much unexpected. As you may have heard of many instances where sportsmen who are actually in their peak performance of their athletic activities, they often die suddenly, and this has happened numerous times even in the field. It has also been reported in many young individuals who never had any heart problem. There was no history of any other problems also, but have died suddenly. So this is what is sudden cardiac arrest. This kills a lot of people. In the United States, it's estimated to kill 2.5 lakhs to 4.5 lakhs every year. But we seldom talk about it. Now, what are the causes for this sudden cardiac arrest? As I've said, the thing which differentiates it from other causes of cardiac arrest is the mode and the way the death happens, and also that most of these individuals do not know that they have a heart disease. They never had any heart problems. So, but still it has been seen that if someone has a heart attack, if someone has a impaired function of the heart, then such cases are more prone to develop sudden cardiac arrest. Similarly, patients who have a congenital heart disease, or maybe some valvular heart disease, or maybe some genetic predisposition which is often evident in the ECG, these are also the individuals who are more prone to develop sudden cardiac arrest. So what happens in a sudden cardiac arrest? How do you know that someone is having a sudden cardiac arrest? What happens? The individuals who get such a sudden cardiac arrest may suddenly black out and may stop breathing, and his pulses may become absent. So if you find someone has suddenly fallen down and is not breathing, has no pulse, then you must call for help, and immediately we need to start cardiopulmonary resuscitation. This is something which you perhaps know is colloquially it's called as cardiac massage and mouth-to-mouth breathing. So these are the maneuvers which are necessary to bring the heart rate back to normal, or at least to buy time till you have a defibrillator available which can shock the heart back to normal. So this is the treatment. You give CPR as soon as possible. You try to get a defibrillator. This is often easy in a hospital setting, but if it happens somewhere outside the hospital, this may be difficult. However, that's the only, sometimes it reverts on its own, but sometimes it may need a defibrillation to revert it back to normal. If a patient survives from a sudden cardiac arrest, then the chances of recurrence is high, and in such cases we often implant a device called ICD, implantable cardioverter defibrillator. What it essentially does, it's a pacemaker like thing, heart rhythm, and if the person sometimes develop one of these abnormal heart rhythms leading to cardiac arrest, then the device can shock the heart back to normal.